So, overview, we're going to talk a little bit about the various definitions of self injury and give you some information about current prevalence, so some statistics. We'll talk about the various functions of self injury, additional risk factors, also give you some information about how to assess self injury and potentially life threatening behavior. And certainly throughout the presentation, I'll be talking a lot about different skills and strategies that you can implement with your students. So when we get to the skills and strategies, I really wanted to break that down as we go a little bit deeper into actual interventions. So we're going to talk about how you can communicate understanding to a student, holding space for a student so that they feel that they can talk to you and receive help. Externalizing behavior is a big part of the work that I do with self-injury because we want to get it outside of the student so that we're able to look at what we're dealing with and also replace behavior. And ultimately, the goal being to change the relationship with non-suicidal self-injury. And we'll talk about that as well. So the definitions of self-injury vary because we've got non-suicidal self-injury, NSSI, and then we have more life-threatening forms of self-injury where people may be at risk of suicide or also are suicidal, who are also self-injuring. So we're going to talk about both groups, starting with NSSI, and then we'll talk about how people can move up the spectrum and into more life-threatening behavior and as an important tool for you when you're assessing risk. So what is the basic definition? Self-injury is the intentional or direct injuring of body tissue, most often done without suicidal ideation. So it varies from self-harming behavior. So self-harming behaviors, I'll give a couple more examples of self-harming behaviors, but one would be potentially substance use. So, somebody may be at risk if they're using substances, certainly drugs, drinking. Absolutely, those can be risk factors. However, I want to be clear that for it to meet criteria for self-injury, it has to adhere to that definition, that it's got to be for the purpose of inflicting damage to bodily tissue. So the DSM is the Diagnostic Statistical Manual that people in my profession use, and we now have a diagnosis for self-injury, whereas before it was kind of a tagline, behavior for other diagnoses. So, according to the DSM, to get the NSSI diagnosis, over the past year, the person has for at least 5 days engaged in self-injury with the anticipation that the act will result in some bodily harm. And again, this is without suicidal intent. Other criteria for the DSM is that the act it cannot be socially acceptable. So in other words, they're not just doing something to, be with their peers or hang with their peers. The act or its consequence can cause significant distress to the individual's life. Relationships can be disrupted. A lot of kids will experience peer rejection. The act is not taking place during psychotic episodes, delirium, or substance intoxication. The individual engages in self-injury expecting to either get relief from negative emotion, to deal with a personal issue, or to create a positive feeling, or all three. In regards to prevalence, most common in adolescents and young adults, with 17 to 18% of young people reporting that they have engaged at least once in their lives in self-injury. It is most commonly with adolescents, but it begins typically between the ages of 12 to 15. And when it starts early in adolescence, sometimes we'll see a decline, but without treatment, we can see an uptick in later adolescence of the behavior. And onset before the age of 12 is typically associated with more severe SI over a longer period of time. So that's dipping into, again, the habituation factor. Whereas we have teenagers who started self-injuring when they were much younger, chances are they have increased the level of self-injury because maybe the shallow cuts no longer are enough to get the same relief, so they either will go to a different behavior or they will start to cut more deeply to try to attain that same results, whatever it is that their self-injury is doing for them. Also, I will say that my younger kids who self-injure typically have a higher pain tolerance, and I think some people are just born with a natural higher pain tolerance. But certainly we also have kids who may have experienced severe physical or sexual abuse. that as a direct result of those early experiences have built a pain threshold, a higher pain tolerance. So if they're self-injuring, the behavior can increase in severity pretty quickly.